Dr. Kateryna Shapovalova.
Thank you. So let's start from our presentation.
Passed the reading test. Very hard words.
Okay. So as you know, October is Breast Cancer Awareness Month. This month is a time to raise awareness and educate ourselves and support those affected by this disease. So we will discuss some important questions such as breast anatomy, why do breast cancer occur, some myths, and how to prevent breast cancer. Okay. This is global cancer statistics, and as you can see on the first left slide, among both female and male gender, there is on first place is lung cancer, and on the second place is breast cancer. But if we are taking only females, on the first place is the breast cancer. So next slide, please. About breast anatomy. Breast is a modified apocrine sweat glands that consist from lobules and ducts. This duct is connecting to the middle center, and it calls areola. Inside the lobules and ducts, there is linear that produce milk. Okay, next one. This is the breast most common pathology. Schematically, you can see some cysts that contain is liquid, and fibroadenoma that is hard structure. Both of them, breast cyst and breast fibroadenoma, is benign. They are not becoming cancerous. And from the left side, you can see some changes that is already cancerous. So it's how it looks schematically. Okay, next one. There exists some viruses theory. So scientists try to understand if some viruses can be a cause of breast cancer. And several studies have linked these viruses with breast cancer and found that some people may have these viruses in their life, but most of the other women who has breast cancer, they never even was infected with these viruses. And the study is going on from 1936, and until now this theory is not proven. Okay, next slide, please. Why do malignant tumors occur in the breast? So, as from previous slide, from anatomy, we saw that there is lobules and there is ducts. So, from ducts occur 2/3 of all cancer, and from the lobules 1/3. And why it's occur? It's occur from inside. As you can see, there is epithelial cells that lining inside the ducts and lobules. And under normal conditions, these ducts, this linears is producing milk. Yeah. Next one. Breast cancer divided into two groups. So if we take all breast cancer as a 100%, so hereditary breast cancer will be only up to 15%. The rest breast cancer will be acquired. So a hereditary mutation, it means it's passing from parents to children. And it's a cause of minority of the breast cancer. More likely, breast cancer occur from acquired mutations that occurs spontaneously during our life. Okay, next one. From the left side, you can see some most common genes that hereditary. But from the right side, it's most common acquired mutations is this gene, HER2 gene. Why? But why breast cancer occur? This acquired, it's due to hormonal disorders. Many breast cancer tumors are hormone dependent, and high level of female sex hormones, especially estrogens, stimulate reproduction of cancer cells and promote their growth. Significant acquired mutation of this gene. When mutation cells begin to divide uncontrollably and leading to development of breast cancer. Next one. More. And one more? Yeah. So some risk factors that lead to breast cancer. First, as you can see, is age. It's like, as example, my mom. Sometimes it's so difficult to convince women after menopause that they should not stop doing yearly breast checkup. And worldwide, breast cancer is more common after 55 years old. Hereditary, as we discussed, is taking only up to 15% from all breast cancer. Early menarche and late menopause. Why? Because it's a big hormonal change in our body, and as we discussed, breast cancer is because of hormonal changes starting with this abnormal cells division. Radiation increase risk of breast cancer, especially if a person was before had some treatment, let's say for lymphoma. And breast tissue density. Breast tissue density, it means it's a ratio between adipose tissue, between fibrous and granular tissue together. So it's basically nothing bad in this. Everyone we individual, but statistically, some changes in breast density, it leads to, in future, so to some breast cancer. Next one. Next risk factors is absence of childbirth or late childbirth. They also statistically increasing breast cancer. Lack of breastfeeding. There were some studies that discovered a woman who has breastfeeding more longer period is less prone to have breast cancer in future. Next one. Hormonal contraceptives and intrauterine device and vaginal ring, it all contain hormones. And that's why it's increased likelihood to develop of breast cancer. About overweight. Most female hormones, they keeping like storage in fat, as we can see, as we said, adipose tissue. So obesity and overweight, especially in postmenopausal period, is increasing likelihood to develop of breast cancer, because of hormones too much contained in fat. Alcohol means regular consumption of alcohol, increasing to have breast cancer up to 20% in comparison with non-drinker.
A lot of people are smiling.
Regular consumption. Yeah. Let's talk about 4 most common myths about breast cancer. So abortion is not lead to risk to develop of breast cancer. Antiperspirants, I think most of people heard this. So there is an opinion that antiperspirants interfere with lymphatic drainage and increase the risk of breast cancer, but it's not proven theory. Third one, about bras. There is some very hard bras, different kind of bras. So it was once thought that bras can contribute to development of breast cancer by constricting and impairing the circulation and lymphatic drainage. However, scientifically, it's not proven. And about age, we already speak that about old women after menopause, they think, halas, already no need, I'm good, but no, should not stop doing yearly checkup until until we die. Yeah.
That's annually, Doctor?
Annually. Yeah, we will discuss in next slides. Breast cancer prevention. So, unfortunately, it is impossible to completely prevent yourself from breast cancer, but there is some measurements that can help to prevent it. Early diagnosis. Early diagnosis is very important. It means every woman should do self-examination every month by her own. And by statistics, around 50% of all breast cancer women examine like palpating by herself. Second one is until 40 years old, do breast ultrasound every year. So why we don't do mammography before 40 years? Because of breast density. So mammography will be useless until 40 years old. So that's why we are doing breast ultrasound. In some cases, before 40 years old, if we found something on ultrasound that needs further investigation, that needs more information, in that case, we will use mammography. Mammography and mammogram is, misspelled. We are using MRI before 40 years old. So MRI and mammography is different. Okay, so if need before 40 years old, we will use MRI. Okay, after 40 years old, every woman should start doing 2 examinations, ultrasound plus mammography every year. So why do we need 2 studies? It's because with age, our breast start containing some calcium, and this calcium can be like say good calcium, and it can be already a feature of something bad start creating in our breast. So this mammography, it's like, let's say, X-ray, so it can see heart structure. So mammography can differentiate if it's good calcium or bad calcium. Okay, next one. This is how doctors examples can see on ultrasound. Yeah, breast cyst and breast fibroadenoma, in comparison with breast cancer, has very clear border. So it's like say in capsule. But if you can see on ultrasound, breast cancer is something like real shape of cancer, so without clear borders. Yeah, it's just example. Okay, next one. And we discussed before that breast cysts and breast fibroadenomas, they are not cancers. Okay. This is mammography. Mammography, we say it's like X-ray, yeah? So it can see heart structure. So diffuse and regional, it's a calcium. This white dots, it means calcium. So it's a good calcium. But if we see like clustered or segmental, it means this is already not good. So it's like breast cancer beginning. Okay, next one. This for some additional information, because many patients asking about radiation, if they're doing mammography or they're doing MRI or ultrasound. So this is an example. And by the way, ultrasound and MRI, they don't have radiation. Okay? Yes, they working in different way, let's say. So chest X-ray and mammography, if we are doing every year, it will not give us radiation.
Yeah, but MRI in general has, not the MRI version. In general, it doesn't.
No.
Oh, interesting.
Next one. Okay. Now about how to prevent of breast cancer. So fight with overweight and physical activity. Yeah, because we need to reduce some fat that contain hormones, especially it's for females, very important. And at least 5 hours per week, and running, jogging is not counting. Okay,